Hello, today I would like to touch on the popular topic, being in a therapy or in treatment. Those who live in Western cultures are really familiar or at least know somebody who was in treatment or was visiting psychologist. What I would like to investigate in today's video is what happens in that process in between those two people. When I mean two people, I mean the therapist, I try to draw a face, and the patient. From very distance, we can say that it's nothing special in such a situation. It's a dual interaction, and it's very similar to teaching, or maybe other everyday conversations. When teaching or when discussing between two people, what happens is that these two people are joining efforts to solve a common problem. And this common problem is usually represented or modeled in both people's mind, sometimes very differently. And this difference, this problem might look in his eyes, in his mind like that, in her mind like this. And what they are trying to do by communication is putting together the different perspectives and reaching a common integrated picture about the object that is their problem. So there is an object in the reality, in real life, and this is represented three different ways. Once in each people's mind, and then it is during the communication it starts to evolve a new representation, a new common integrated representation of the same object. To understand what happens during problem solving, and we will see that therapy is nothing different from, it's almost no difference from problem solving, is that each person, so both him and her, has a hierarchy of cognitive schemas or schemata in their mind. These cognitive schemata, you could learn from my previous videos, are basic representations of the environment. So you might remember that from the environment there is a real object, and these representations are built up of schemas, of small notions or words or phrases that are connected between each other. And when you say a problem, when you face a problem, is that the information that come from the environment through these schemas, they are delivering a different output than the owner of these schemas is expecting. So this is the expectation, and this is the output, and there is no congruence, there is no harmony in between the two. Solving a problem usually means restructuring these schemas. In other words, seizing some connections and building up new ones. And by changing different small connections or building up new ones, the output will be very, very different. So this is output 1 and will be very, very different from the new output number 2. And I have to say that during this restructuring process, not only output 2 but output 3 and so on, many outputs are created. And these outputs are what we call trial error, or producing these outputs is a trial error, because you are restructuring these cognitive schemas until the requested or expected output arises. What is this is a general description of problem solving, and what is special is that the problem, this problem is in somebody's mind, and the other person, so this is the client or patient, and this is the therapist, psychologist, who is helping the client to restructure its cognitive schemas about himself, or those schemas that are controlling or conducting the client's behavior. Solving a problem usually needs space, as I would need also some space here, but I have some small software problems. In order to solve problems, like when you are playing with a puzzle, you need a big desk on what to work, a clear desk, in order to put your schemas to identify and to put them separately. So during therapy, there are two processes going usually parallel. One is identifying schemas and understanding what are those basic models of the environment that is all the personality built on. And when in popular culture you hear about traumas, and these traumas can mean that one of these basic schemas is performing wrong, or is wrongly built, and in that case these schemas have to be zoomed, and their inner structure has to be investigated in more details. And as from previous videos you could see, inside the schemas you can find very similarly structured schemas again. So when a psychologist says you have to go deeper and deeper in your memories and your personality, means that from this above level, from this top level that is very close to your everyday behavior, to the output you perform each single day, you have to go deeper and deeper, understanding what is really below, what are the basics of this behavior. And by zooming the lowest level, structures that can mean memories from childhood, or different patterns, or different beliefs. You are identifying your motives and why you are doing something. The other process what is going on in the therapy is restructuring the connections between the schemas, meaning that maybe if information flows this way, delivers an output that will be used in above and above in your cognitive structure, and you have to seize this link and to connect to another one, and maybe this one will deliver a good output. Why is the therapist needed? Now maybe I will surprise you. I will say it's not needed. Those people who are exercising yoga or meditating, or they are going on long trips alone, they are doing the same process, but they are doing alone. When you are just laying on your bed and thinking or maybe dreaming, the same process is happening. You are restructuring your schemas in order to deliver a good output that fits your needs. So why are we paying psychologists? The reason is the same why we are paying teachers. Because an external party is helping you when both in identifying the soul schemas, saying, for example, that this schema is contradicting to another one. Yes, you are right, you might also notice that it's contradicting to another one. But an external person who is focused on a kind of quality assurance or quality control is always acting as a consultant of you to see whether your schemas are working or are right or wrong. This is one thing. The other is that when you are contemplating inside, you are investigating on yourself these schemas, then you are not forced to think in digital, meaning black or white, so clear notions. So if this is 0, this is 1, you in your dreams or when you are alone, you can put once here a value, other times here, just to tell you an example, how much you love your parents. Once you say, I love them a little bit, sometimes I hate them, sometimes I hate them very much, or I love them a lot. When you are at a psychologist, you cannot be that detailed because there is a limitation of time, and there is a limitation of the human language. Those diffuse, unclear pictures that are in your mind, you have to clarify them, even if by clarifying a lot of small details are lost. You can imagine like something like that there you have a schema that is on the very surface. You will say this one. If you are going deeper, you can identify this one, but in the reality they are based on this level. But this level is very, very diffuse and unclear, as there is no limit. There is a limitation how much you can tell about this specific schema. You won't go too deep, so you will stop on a good enough level, and you will describe your feelings or your memories in this relation. There is one more reason why using psychologists, and that's what we call blind spot. Blind spots are those schemas or connections in between your schema system that might endanger your whole output ability to perform outputs, and that's why you are afraid to see it. An external party might help you connect two big regions or two big schema subgroups that would be ideal to connect, but for some reason, because of your traumas or different memories, you are afraid to connect. So this is the blind spot that you can't see, and if you would be able to connect these two schema, then you would perform much better. You will deliver a much better output. Just to put again a good an example, when connecting different people or similarities to different people, when the psychologist says that your mother is very similar to your wife, or your father is similar to your husband, or you are treating your child similar to how you treated your grandma, whatever, this is of course something that professionally can be learned, and the psychologist learns about typical patterns you can find at people. So usually they have a kind of checklist that, okay, let's check whether there are similarities between the dog and the house. I wanted to say something extreme, but usually you might have heard of the Freudist complexes, that people are choosing similar partners than their parents. So they are checking whether the partner and the parent, there are similarities or not. Okay, they didn't find anything, that they go over. If they found something, then they could establish a huge and important link that creates a new integrated schema about, in general, what you are doing, what happens in when you are behaving, and this experience gives you a more transparent, much better working schema system. I'm sure that this topic can be discussed even in more and more details, and this, what I have mentioned, are only some lines that were the most obvious, but I hope that I could give you a new picture about what happens when a client is visiting a psychologist. Thank you for your